Okay, so hyperthyroidism is a condition in which your thyroid gland becomes overactive by producing way too much T3, T4, therefore putting your body into this hypermetabolic state. And it's this hypermetabolic state that's going to help us understand some of these key assessment findings. And so there are three major systems that are overly excited when it comes to hyperthyroidism, and that includes cardiac, neuro, and GI. And because of this hypermetabolic state, we can expect an increase in pulse and blood pressure when it comes to our cardiac system. And we can also expect to see symptoms like elevated temperature, tremors, and restlessness when it comes to our neurosystem. And within our GI system, we would expect to see things like diarrhea and abdominal cramps. Exophthalmos is a condition which the eyes bulge out, which is a key characteristic of hyperthyroidism. We can also expect to see nutritional changes because of hyperthyroidism, and that includes weight loss and increased appetite. And so the treatment for hyperthyroidism includes anti-thyroid medications such as methimazole and propylthiouracil, or PTU, which essentially decrease T3, T4. And then we have a thyroidectomy, which is the removal of the thyroid gland to help with those symptoms. Then we have radioactive iodine, which also decreases T3, T4 synthesis. Then we have beta blockers such as metoprolol, which are going to help with those cardiac symptoms. So it's going to help decrease that pulse, decrease that blood pressure. Acetaminophen, which is an antipyretic, is going to help with fever, which is one of the neurological symptoms of hyperthyroidism. And so the nursing care for a patient with hyperthyroidism is all wrapped around those key assessment findings. Patients are going to have symptoms within each of these systems. And so our job as nurses is to provide support within each of these systems. And that includes dietary, educating, and supporting our patients based off of the assessments that we see as nurses. Then we come to the complications. So when a patient has a thyroidectomy, post-operatively, the most important thing we're watching for is airway obstruction. Now, because we are overly exciting that neurological system, patients are at risk for developing seizures, so we've got to watch out for that. Osteoporosis is another complication that can occur because of this hypermetabolic state, which leads to bone breakdown. So because we're exciting the cardiac system, the patient is at risk for developing arrhythmias. Thyroid storm is the most severe complication, and it happens because the neurological and the cardiac system are so overly stimulated that it can lead to hypertensive crisis, coma, and death if not treated immediately. So now that we've reviewed the basics of hyperthyroidism, let's challenge ourselves and take it to a practice question. If you need time to review it, just pause the video here and then unpause when you're ready to go to the practice question, okay? Okay, let's read. So the nurse is assessing a client who just returned from a thyroidectomy 2 hours ago. Which client assessment finding would the nurse prioritize reporting to the healthcare provider? Is it A, an increased swelling of the neck, B, SpO2 of 93%, C, a blood pressure of 150/88, or D, blood noted on the surgical dressing? So if you need more time to reread the scenario and look at those answer choices, go ahead and pause the video. And whenever you're ready, just unpause it and you will see the answer, okay? So the correct answer choice is answer choice A, increased swelling of the neck. Why? Well, the patient just had a thyroidectomy and they're having increased swelling of the neck. Well, we know that the neck is the area in which your trachea is. And so if there's swelling there, that means your patient is at very high risk for airway obstruction. And that is why it is the priority, because that symptom correlates with airway obstruction. Although an oxygen of 93% is less than 95, it's not immediately concerning. We'll continue to monitor that. The blood pressure of 150/88, elevated, but we're just going to continue to monitor. And we would expect there to be a little bit of blood on the surgical dressing. And so I hope that makes sense. Follow for more.